and this will increase the chances of transmission. What about the viral infectivity? Increased virulence leads to increase in transmission rates because it augments the number of viruses that are present in the host secretions, increases the viral load. So these are viral factors. And that is why they say people that are infected with HIV variants of higher virulence could be expected to infect higher number of people within the susceptible population. That is to say, just for short, those that have virulent HIV strains are likely to infect more people than those that have low virulent strains. Virulent is an innate property of the virus. When you say it's like somebody having power, he has muscles. Because of the muscles, he has more strength. So the viral strains have tendencies to be virulent, and these are innate properties of the viral strains. Host susceptibility is the ability of an uninfected individual to get infected when exposed to the virus. There are some factors that influence the host susceptibility. One is a break in the integrity of the skin or the mucosa, either the vaginal or the rectal mucosa. This facilitates infection. What about herpes simplex infection? When you have malaria, one thing that shows, you see blisters on your lips. But there are also some, what you call blisters also within the vaginal area. That leads to ulcers. This increases the chances of HIV transmission. Sources of abrasion within the rectum, anything that will cause bruising within the rectum or the vagina, there are practices such as vaginal douching, or what you call with rectal douching. You flood it with some compounds. The process of trying to enter the area to create some friction. It creates friction, and then there is bleeding, and then some people that use tampon, it can also facilitate HIV transmission. For estrogen-containing contraceptives and sexual intercourse during menstruation, these have been associated with high HIV transmission. Yes, we know that estrogen is supposed to increase the thickness of the cervical mucus. The cervical mucus is supposed to thicken, it's supposed to protect against HIV, but we have now seen that's associated with a change in cervical ectopium. And so it changes the cervical ectopium and predisposes people to chlamydia infection, cervicitis, and cervical changes. These changes facilitate, it leads to HIV infection. Okay? Yes. So because it changes the cervical, ectopium, that way it predisposes people to some other bacterial infections and cervicitis, and this predisposes to HIV entry. In men, there are some men that are not circumcised. Circumcision is good. It has been found that lack of circumcision has been associated with a higher risk of HIV transmission. Of course, blood products, it holds true. That's one of the fastest means. Just take blood. Some people will treat some clotting factors. That is clotting factor. If you heat blood, how many of you have eaten pepper soup? Some people in some parts of Nigeria, they talk about pepper soup that they use blood. Yes. The moment you heat blood, you destroy the blood. So you don't sterilize blood by heating. So it's very easy. The best you can do is to screen the blood before transfusing the blood. What about a local place where there is no transfusion center and somebody is needing blood? What happens? They will just tell you, anywhere you can get blood, we need blood 12 midnight now. If not, the person will pass out. They will go and look for blood. They don't care whether it's from a HIV or AIDS patient. And since HIV does not show in the face, chances are that people will just begin to take any blood and administer any blood. Once this happens, it creates serious problem because HIV transmission will be activated by that transmission of the blood or blood products. Let's look at mother-to-child transmission of HIV. Mother-to-child transmission of HIV. Most HIV infections in infants in the developed and developing countries are acquired through infection of their mothers. And this occurs in 3 ways. The first is through the placenta within the mother. The second is during delivery. During delivery, there's blood all around from the mother. You see, when people have HIV, there's a drug that is administered once the baby is getting bigger, getting towards the 3rd trimester, to suppress the viral load so that the baby can come out through CS. So during the process of birth, chances are that the baby can be exposed. And then there's the postnatal infection, that is after the birth, through breastfeeding. And so they advise somebody who has HIV should not breastfeed the baby, just to protect the baby. Studies have shown that breastfeeding accounts for most of the mother-to-child HIV transmission. In most HIV-infected women, HIV does not cross the placenta from mother to the fetus. Instead, the placenta acts as a barrier that shields the developing fetus from the virus. And that is why it is easy for them to carry a mother that does not have high viral load may not have a baby that is infected. There can be a breakdown of the placenta. Maybe when the mother has a viral infection, a bacterial infection, or parasitic infection, or maybe when the mother becomes infected with HIV during pregnancy and develops a high level of viral load for a short time, that barrier, that placental defense will break down. When the mother also has a severe immune deficiency that is associated, that is AIDS, it happens. Untreated placental conditions, infections such as malaria, and that is why you see malaria treatment during pregnancy is very, very important. Very, very important. During pregnancy, it is important for you to take very good nutrition. So malnutrition must not be, we don't want malnutrition, because malnutrition is indirectly contributes to maternal to child transmission of HIV. During labor and during delivery, the infant born to HIV positive mothers are at a serious risk of becoming infected as they are passing through the birth canal. In this event, about 10% to 20% of newborns acquire the infection if no step to prevent transmission to the baby is taken. Most infants that are infected during labor, they are infected by sucking, okay, or maybe aspirating maternal blood or cervical secretion during that contain the HIV. The baby will aspirate maternal blood by suckling, cervical mucus and all that contain the virus. So HIV transmission occurs through breastfeeding, like we have said. The HIV is present in breast milk. The concentration may not be much, but then it has been shown that 15% of babies that are born to HIV positive mothers are likely to become infected by prolonged breastfeeding. We have to ensure that this is not done so as to protect the baby. There are other variables that may increase the risk of infection during breastfeeding. Presence of cracks in the nipples, abscesses on the breast, or infant oral candidiasis. So when the baby has oral candidiasis, oral thrush, you see white blemish on the tongue of the baby, it predisposes the baby to infection from the mother. The use of exclusive breastfeeding compared to mixed feeding also predisposes. So exclusive breastfeeding. Someone who has HIV is doing exclusive breastfeeding, it may not be very, very good for a baby. A randomized clinical trial that compared breastfeeding to formula feeding in Kenya found out that about a high number of infants was associated to people that took formula instead. They survived, higher. They had higher improved chances of surviving compared to those who were, strictly on breastfeeding. So it's encouraged. Now let's look at the social and cultural factors that influence HIV. HIV-associated stigma and discrimination. Now, some of us know people that have HIV. In those days when it started, in fact, the first person that had HIV in Nigeria ran away. He ran to hiding because of stigma. Immediately, people's family members knew that they had HIV. Everybody would just avoid them. But now, we know rich people that have HIV around us. It's not a life sentence. Now there are drugs. There are drugs. Stigma and discrimination should be discouraged. HIV is just one other disease. There are other diseases that even kill faster than HIV. Rabies, for example, give the person 14 days. The person is gone. Once the person begins to develop signs in the brain, the person is gone. Then we have socio-economic status, poverty. Poverty is a serious problem. When somebody is looking for food and the person does not have food, we're not saying it's a license for people to go and start prostituting. Prostitution is bad. Should be discouraged. Work hard and you get something to do. Yes, and you get by. You don't have to prostitute. There are male prostitutes, I hope you know. There are male if you go to Lagos State, Nigeria, in Lagos. Not only Lagos. So there are male prostitutes today. They make money off women. There are some rich women who don't have husbands. And then they look for these young boys and then they give them money in return. What about the culture and traditional practices? Widow inheritance. Some people inherit widows. It's a practice that should be discouraged because you don't know if the husband died of HIV in the process. They transfer the virus. What about mass male circumcision and female genital mutilation? They come together and they say, okay, let us just do it once and for all. It's painful. All of you, come, let's do it once and for all. It's a cultural practice that is not too good. It increases the chances of HIV transmission. What about gender discrimination? Gender discrimination predisposes people to HIV transmission. What about war and armed conflicts? How does this happen? During armed conflicts, a lot of people scarification. The courts, I just told you what happened in Liberia. Soldiers go there, and we've talked about the risk groups. So, of course, it's a social factor. Once there's war, soldiers go there, they don't care, and then they have indiscriminate sex, many of them not using condom, and so it's a problem. What about drug and alcohol abuse? It is a serious problem. In conclusion, prevention of those factors can be eliminated, those predisposing factors can be eliminated through, first, health and peer education, elimination of very bad cultural practices, disclosure of status. If you want to marry somebody and you have HIV, the person has HIV, it is good to disclose. I know somebody who is HIV positive. He disclosed to his partner and she accepted. The man has money. Yes. So the man has money. What about promotion of gender equality? There are some things that people do that is not right. They say because you are this particular gender, I can do this to you, I can do that to you. It is wrong. And that's why we are promoting gender equality, so that you will not say one gender is more superior than the other. Then we need to adopt pro-HIV reduction policy. Because if in an institution, there's no policy that safeguards, prevents HIV. And that's one of the reasons why we started this course in the first place. And today, we are very, very happy that the rate of HIV on the campus of University of Ibadan has reduced. Thank you very much, and I hope that you enjoyed this session. Thank you.